Can you prevent tearing during childbirth? If you're pregnant and you're planning on having a vaginal delivery, tearing is something that a lot of people are nervous about. I'm Dr. Alex Hill, and I'm a board-certified women's health physical therapist. Let's get into what tearing is, what the risk factors are, and can you actually prevent it? A vaginal tear happens during childbirth, and it's when there's a tear in the tissue around the vagina and the perineum, which is the area between the vagina and the anal opening. All right, so here's your pelvis. You've got baby growing inside the uterus, and if we look at the bottom part of the pelvis, these are all of your pelvic floor muscles. The labia sit on top of the pelvic floor muscles here. And so underneath the labia, you have all of these structures. You've got pelvic floor muscles. This is the opening of the vagina. Above that, you have the urethra. And then below that, you have the perineum, which is the area between the vagina, and then you have the anal opening. So the vagina, the pelvic floor muscles, and the perineum do stretch to allow your baby's head to pass through the vaginal canal, but it's pretty common for tearing to occur. Upwards of 80 to 90% of people who give birth vaginally have some type of tearing during delivery. So first, what causes tearing? Well, there are several factors that can increase your risk, and these include that it's your first delivery, use of forceps or a vacuum during your delivery, your baby comes out face up instead of face down during delivery, you have a large baby over 8 pounds, and you have a second long stage of labor, meaning you're in the pushing stage for a really long time. You can also talk with your medical provider about any additional risk factors that you might have. So now let's talk about what the 4 types of tears are, which are based on the severity of the tear. A first-degree tear is the least severe tear, and it involves just the first layer of skin around the vagina and the perineal area. This usually doesn't need stitches. A second-degree tear is the most common type of tear, and it does require some stitches. The tear is slightly bigger and it extends deeper through your skin into those underlying muscles of your vagina and the perineum. A third-degree tear extends from the vagina to the anus, and this also requires stitches. This type of tear involves injury to the skin and the muscles of your perineal area, as well as those anal sphincter muscles. Now the last one, a 4th-degree tear, is the least common type of tear, but it's also the most severe. This tear is going to extend from your vagina through the perineal area and into the sphincter muscles all the way to the rectum. Your medical provider may need to take you to an operating room to repair this tear since it is a more severe tear. Now, although I talked about all of these tears going from the vagina backwards through the perineum into the anus or rectum, you can also tear at the opposite side of the perineal area. These are called periurethral tears, and the tear goes up towards the urethra from the vagina. So what can you expect if you tear? Well, although these tears can be uncomfortable and painful, most of those smaller vaginal tears will heal within a couple weeks. If you have a more severe tear like that 3rd or 4th degree tear, this can take longer to heal, and you may also have more complications like leaking poop, called fecal incontinence. That's because, again, that tear goes to those anal sphincter muscles and potentially to the rectum if it's that 4th degree tear. Tears going downward can also cause pain or discomfort with intercourse, especially with that initial penetration. And if you have a tear going upwards towards the urethra, you could have some discomfort and pain with urinating or going pee. So one of the most common questions that I get is, can you prevent tearing during childbirth? And really there's no absolute way to avoid tears, so that's unfortunate. Now there are some strategies that you can implement to decrease your risk for tearing, but even with these interventions, there's no set guideline or protocol for what is best. That being said, I'm going to give you 2 tips, but always check with your medical provider first. First up is doing a perineal massage during pregnancy, so massaging that bottom part of the vaginal opening. The research is mixed on whether massaging the perineum in those last couple weeks of pregnancy will decrease the severity or frequency of tearing, but it's not likely to do any harm. The key for perineal massage is to do it regularly, at least a couple times a week for about 5 minutes at a time. Check out my next video next week where I go into exactly how to do this perineal massage. Besides doing the perineal massage before you deliver, you can also do the perineal massage and apply a warm compress to the perineum during labor and delivery. There is some research to show that this can help decrease your risk for significant tears. And finally, consider what position you're delivering in. Kneeling, being on all fours, or lying on your side may help to reduce the severity of tearing. Again, talk with your doctor about what's best for you and how you can reduce your risk of tearing and still have a safe delivery. All right, please like this video if you found it helpful and subscribe to my channel for more content on pelvic health for after delivery.